There's an alarming observation that's hard to ignore in our society. The place you identify as home influences your chances of becoming obese. It's about how the socio-economic level of your area directly contributes to your chances of obesity. Australia has been tackling the pervading issue of increasing obesity. In 2018, obesity cost Australia $11.8 billion. This means that more than 2% of our total tax goes to alleviating this highly preventable health issue. Within Australia, people living in disadvantaged lower socioeconomic regions are more likely to face obesity. These areas are situated in remote and regional Australia, where the average obesity rate for these areas soared from 20% to 39.2% within 18 years, contrasting to its counterpart, major cities, where there was only a 6% increase. This creates an immense gap in obesity rates between these two demographic areas.
Well, how did this happen? People who live in the most disadvantaged areas are more dependent on cars for mobility, where higher car usage is linked to an increase in weight gain. The population are prone to unhealthy behaviors such as excessive smoking, alcohol, and drug abuse, with a larger preference to consume cheap, fast, and highly processed meals. These areas have less access to healthy and active spaces and have lower community trust, hence discouraging physical activity, especially individual exercise like walking, that are extremely popular for adults. Furthermore, there is a lack of connection between these populations and fresh produce, where fresh foods are often highly inaccessible. This rising health concern is identified as a key challenge under the United Nations SDG targets of 3.D, 11.A, and 11.3, signifying a health gap between the most and least disadvantaged areas of Australia due to the built environment and social factors. A public health expert from the Australian National University has mistakenly linked the growing prevalence of obesity in Australia to the current Australian food environment. They blame this obesity issue on the rise of unhealthy food options, aggressive marketing of junk food, and the ease of accessing these unhealthy products. However, they fail to address that this issue mostly affects disadvantaged areas in Australia and not Australia's most advantaged areas, where healthy lifestyles and healthy food behaviours are highly encouraged and glorified. To reduce higher rates of obesity in certain disadvantaged geographical regions, sufficient aid should be provided to these populations. This could be creating more bike and pedestrian-friendly pathways to promote active transport and a healthy environment, whilst decreasing the high dependency on cars. Having motivating posters showing people exercising happily around disadvantaged areas can promote a positive image of physical exercise, whilst increasing physical activity level within the community. Another possible action is to create community gardens to connect the population to fresh produce and also to increase the population's access to fresh food products. This can also increase physical activity levels whilst promoting communal social connection.